Welcome, everyone. Thank you for joining us again today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 488,638 confirmed cases of COVID-19 in Canada and 148,967 cases in Ontario. Chatham-Kent has 570 cases, and Sarnia-Lambton has reported 470 cases. Michigan now has 450,776 cases, with 23,992 cases being in Detroit. Today, we are reporting 243 new cases of COVID-19 in Windsor and Essex County. 31 cases are related to outbreaks, 5 are close contacts of confirmed cases, and 207 are still being investigated. We have had 5,446 cases of COVID-19 since March. 4,337 cases are now resolved, and 1,014 cases are active and being followed by our health unit. 66 confirmed cases are currently in the hospital, and 14 people are in ICU. In Windsor, there are 71 suspected cases of COVID-19 currently hospitalized. We are reporting an additional death today, a woman in her 60s with underlying health conditions. Our community has lost 95 people to COVID. 59 deaths have occurred among residents in long-term care and retirement homes. There are currently 28 active outbreaks in Windsor and Essex County, 10 in long-term care and retirement homes, 11 in workplaces, 2 schools, 3 community outbreaks, and 2 hospitals. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for the weekly EPI summary.
Good morning, everyone, and thank you for joining us today. As the cases are piling up in Windsor-Essex, we reported 243 cases today. And things continue to get worse for our healthcare system, as many of the indicators that are now currently pointing out to more outbreaks and more active cases in the region. Looking at globally what's happening around the world is we can see many of the countries are experiencing a similar wave. Some countries doing better than the other, and a lot of that is reflected by the kind of measures that are put in place to contain the virus. Some of the countries that I put in to give you an indication of what kind of measures each of these countries have put in place and their response, what we have seen throughout this pandemic. A notable example here in this particular graph is France, with very high cases, and later in the month of October, early November, they implemented a full lockdown of their country, which resulted in a significant decline in a very short period of time for the entire country, bringing the case rates, which is now similar to Canada. But as you can see in the graph, the green line, it's showing you how bad it got at one point. Among other countries, U.S. has put some restrictions, not followed properly, and continue to see the highest rates still among many of the developed countries. Sweden, another country with minimum restrictions, minimum lockdown, and is seeing the case counts, which is pretty much closer to what U.S. is seeing based on a per million population. Germany is another example that has implemented a severe lockdown in the first phase of the pandemic, which resulted in a very significant decline in the number of cases and no transmission in the first phase. Second phase, they did some lockdown or some measures, implemented some restrictions, but not far enough, and that resulted in a surge in cases that they're continuing to see. We've got lots of evidence, data from all these restrictions that are put in place, which scientifically explain that restrictions put in earlier proves that the number of cases will decline significantly. Canada has done so far a better job comparing ourselves with other countries, but internally we can always see that there are things that are getting to the point where it can easily bring the entire country to a situation where with widespread transmission, putting everyone at risk. So this particular graph looks at the cumulative confirmed cases, which obviously takes into consideration the population and all of those other details. And the data looks very clear from the cumulative perspective that U.S. continues to lead the world with the cumulative confirmed cases of COVID. Looking at the daily confirmed deaths across the globe, United States again leading as one of the highest country with the most cases per million population, followed by Sweden and Germany and France. Canada still is doing relatively well, but we know that death is a lagging indicator. So whatever we are experiencing, we may see the impact in the next 2 to 3 weeks at the most. So this factors in the cumulative confirmed COVID-19 cases, and as we can still again see, Canada is somewhat better than other countries, but again, it's worse off than Germany and maybe some of the other countries in comparison. So focusing now specifically in Ontario, this is what the daily average case counts looks like based on a 7-day average. And as we can see with the first wave, the most we have seen with our daily 7-day average was close to somewhere around 500 to 600 cases. But now we are averaging close to 1,900 or 2,000 cases every day, which is almost 4 times or 3 to 4 times higher than what we have seen in the first wave. So that is a clear indication in terms of when you're talking about whether if things are worse or if things are better than where we were. We learned a lot from our first wave response, but as we have predicted enough as well, based on the number of pandemics that the world has seen, the second wave has always been worse than the first, and then part of that is the reaction and response after the initial surge of cases in any kind of pandemic. The reaction, the support, the commitment for people to follow those public health measures are much better in the first wave, and the second wave then they tend to be more careless because of knowing more about the virus and the spread, and a number of other factors as well. One thing good to know, even looking within Canada as well, that the first wave has probably brought in more deaths in the country, but because we were dealing with a novel infection, a novel disease with limited treatment options. But then as we learn more about the disease, we are saving more lives. But on the other hand, we are seeing much more cases in the community and everywhere else. Looking at the epi curve by reported date in just Windsor-Essex, this is what it looks like. And as we can see, again, even in the worst pandemic, what we have seen is our average weekly case rates were 35 per 100,000 population. What we are seeing right now is much worse. It's in excess of 100 cases per 100,000 population, which is again touching very close to 3 times the case rates that we have seen with the worst part of the pandemic with the first wave. Just focusing in the most recent time, September, October, as a community, we have done a great job in keeping our case counts low when many of the municipalities, many of the regions in Canada were experiencing already started to show the evidence of second wave. We did very well, but then by the end of October, early November, things started to change, and then that trend continues to worsen with more and more community transmission, more and more cases spreading out into many different settings, with the high number of outbreaks that we are seeing everywhere and in all the vulnerable population, leading to many of the fatalities, many of the hospitalization that we are seeing right now. So looking at the cumulative cases and deaths in COVID-19 in Windsor and Essex, and this basically the easiest way to understand this graph is to look at the steepness of the curve. The steep the curve is, the bad it is, because we're accumulating cases very quickly in a very short period of time, with no ability for the healthcare system to react and respond to those cases, and potentially bringing the entire community, putting entire community at risk of not able to care for those people who are sick, and not able to care for those people who may require ICU hospitalization, resulting in deaths in the community. Looking at the weekly case rates by reported week, and as we can see, this is another example to look at the case rates that we see every week, and this goes based on the calendar dates by week. And so far, what we are experiencing right now, our most recent completed week case rate is 165.2 cases per 100,000 population. And just to reiterate the same part, that even with the first worst case of pandemic, based on the calendar weekly rates, the worst part when we were there, it was even still less than 60 cases. So we are again 3 times higher than what we have seen with the first wave, and that trend is still going up. It's not going down, it's not plateauing, it's still in the upward trajectory. This is what our weekly COVID-19 case rate looks like compared to the province of Ontario in yellow, and then the southwestern region in green. Clearly, the provincial rate was high back in the week 37 to 38, and then Windsor-Essex rate started to climb after week 45 and still on the rise, leading all the way up to 165 cases per 100,000 population, right behind the very hardest hit region of the province. So this is what our surveillance, the wastewater surveillance data looks like, and we shared this data. We started sharing this graph for the last 2 weeks, and based on this, again, this is still part of a research study, and it gives us some indication, some correlation between what we're seeing in the wastewater of Windsor-Essex versus what the actual case round counts in the community. There is some correlation that we have figured out based on the wastewater surveillance data and the active cases. We have seen some dip, but then we are still again seeing an increase in the wastewater surveillance data, which pointing out to the fact that we'll continue to see more cases in the region. Our person positivity data, based on all the tests that has been conducted so far, by December 5th, we've completed 161,560 tests, and our person positivity up until that time is 5%, which is again very high compared to many of the other regions. And last week, we approximately conducted 9,828 tests. So comparing our person positivity with many other regions, our region is only behind Peel at this time when it comes to person positivity using the 7-day rolling average. And this is not based on the calendar date, this is just based on the 7-day rolling average. And based on that, our person positivity is just behind Peel and currently standing at 6.3% of all the tests that are being conducted. So as you can imagine, with more testing done and with more cases showing up in the region, the percentage of test results that are becoming available within 1 to 2 days is going down as well. The number of cases that we are getting the results back is because of all of those delays, because of lab pressures. Approximately 12.1% of tests that are being processed today with results available within 1 day of being tested. So this is a significant decline from the last week where we were at 40%. So there has been this decline based on the amount of pressure that the lab and the assessment center are seeing right now. Within 2 days of being tested, 64% of the tests are being processed with the results available. Again, this is a decline from where we were before last week, which was at 79%. When it comes to our provincial, our case rates and comparing it across the province and across the other jurisdiction, Our case rates are right now are followed only by we are behind only from Peel and Toronto with our case rates, and this includes all the cases right from the beginning of this pandemic all the way up to here. And then from an overall population perspective and the size of the health unit perspective, you can imagine the community and the size of population that we have with those two large urban centers and the amount of cases that we have in our region. Breaking it down further, our case rates per 100,000 by municipality. This is, again, a cumulative picture, which means all the way starting from the beginning of this pandemic. No surprise there, Leamington and Kingsville had the highest case rates in the region based on the many cases that we have seen in the temporary foreign worker population and given the smaller size of the town. But other than that, outside of this group, the highest number of cases, no surprise there, is Windsor, followed by many of the other municipalities. Similar cases with slight variation with respect to the case rates. Just focusing on the case rates from November 1st to present. Again, Leamington being a smaller community with many farms, the rate is high in the town of Leamington, followed by Windsor, and then Tecumseh, and then the rest of the community, the rest of the municipalities case rates are highlighted there. From a distribution of COVID-19 cases by municipality perspective, and again, this is a cumulative picture. This is all the cases that we have seen so far. Windsor contributing to 50% of the entire case in the region, followed by Leamington and Kingsville. But Leamington and Kingsville, the majority of the cases were from the farm workers, while the rest of the municipalities are hovering around between 2 to 3% of the entire case counts in the region. Focusing just on the last 30 days, Windsor continues to have the highest number of cases, 71%. So this has been a change in what we have seen throughout the pandemic. Our pandemic overall case distribution was 50% in Windsor, but now it's creeping up to 71% with some cases in Leamington, partly because of the farm cases, and then the rest of the municipalities between 2 to 5% of the cases. Not much difference when we're looking for focusing just on the last 7 days. The picture continues to be the same, with the largest contribution of cases coming from Windsor and Tecumseh, followed by with 8% of the cases, LaSalle 7%, and again, this is just the last 7 days, and it changes quite rapidly. Looking at the age and sex breakdown of all the cases, we continue to see the trend with most of these cases between the age group of 20 to 39. In the last 2 weeks, we have seen some more cases between the ages of 20 to 29, but also among the younger group between 0 to 19, and many of those cases are linked with the schools, and we continue to see cases in that population, something that we continue to monitor. This is what it looks like from our cases that are non-epi-linked, which we can say about community transmission. And as we can say that even though if we are saying 27% of our cases based on this 7-day average is as a result of community transmission, but when you factor that in, right now with 240 cases, or let's say even round off 200 cases, 25% or 27% means 50 cases that are linked to that are non-epi-linked. That means we don't know the source of this infection, and this highlights the magnitude of the community transmission that we are seeing in the community, not just by percentage, but also by looking at the actual number of cases. And that number could be high because obviously there are people who either are not aware of their status, or even if they are aware of their status and if they are not following public health guidelines, they are out and they are potentially passing it on to other people. So whenever we are talking about the active cases with high rate of community transmission, essentially that means that the actual cases are much higher than what we are reporting here in the region. So by default, and I've said this many times in my presentation, when I am meeting someone, I assume that they could be positive, and I have to take all my precautions to make sure that I do not contract with them. And again, going back to the gray lockdown criteria, we're not supposed to meet anyone. So just putting things into perspective, if we are truly following that, we shouldn't be seeing all of this community transmission. And if we are seeing this community transmission, if we are seeing people are still getting infected, that indicates that there is a lack of adherence to the protocols and guidelines that is provided to people. Looking at the exposure history data, and again, this is a stacked bar graph, just looking at how these cases are accumulating in the region. And one notable is you can see in the gray that there are many cases that are currently under investigation, and which basically means that we are, the case investigations are on the way, and we haven't narrowed down a potential source that how they acquired the infection. But without even seeing that, we can still see the majority of the cases that are coming in from a result of either a household contact and as a result of outbreak with a significant amount of community transmission. So it's pretty much everywhere representing a wide spread community transmission happening, and then as a result spilling into these high-risk settings, leading to many outbreaks, whether we are talking about workplaces, whether we are talking about long-term care home and retirement home. So this is a new graph that we have added, which shows the acquisition sources of all these cases in the municipality from November to present, and just to give you an indication of how these cases are, whether it's a result of household contacts, outbreak related, and where is this coming from. So this gives you a further breakdown with respect to your municipality and the activity that's been happening in each of these municipalities. So looking at the current number of active outbreaks, and as we can see that it's getting worse, leading to a significant amount of work and significant amount of activity that we are supporting many of these facilities from an outbreak perspective. And the details of those outbreaks we share quite regularly, including outbreaks in the long-term care home, retirement homes, schools, farms, and other workplaces. Our hospitalization and ICU for COVID-19, and this focuses on moving onward from June and onward. And as we can see, the trend is concerning with the number of cases, hospitalization, and the ICU utilization as a result of COVID is increasing at a rapid rate. This figure looks at the acute care bed capacity. This looks at the ICU capacity, and this looks at the ICU with people who are currently on a ventilator at this time. So with respect to our current outcomes, 80% of our cases are resolved, but the number of active cases continue to increase that are currently self-isolating, 4.5%, which is a significant number, crossing the 1,000 mark at this time. So there are more than 1,000 cases that are currently active in our region. And on top of that, there are a significant amount of cases that we are currently still in the process of being updated, and the investigation is ongoing. Among those who died in the region, the age distribution hasn't changed much with respect to majority of the cases that died in the region were 80 years and older. We had our youngest death in our region with 2 people in the age group of between 20 and 29. So our overall case fatality rate in the community as well as in the long-term care home is much better than the provincial average, which is a good sign and a response to our healthcare system that we did better than the provincial average and many of the other regions in terms of saving lives. But still, with the number of cases that we are seeing in our region, that is a concern, and it's still pointing out that more efforts need to be done to save all these lives. Looking at our day-to-day doubling time comparison, and we did fairly well, as I mentioned before, in September, October, were much better than the provincial and the Canadian average, but then things start to get worse, and focusing just on from September onwards, this is what it looks like. Our current case doubling rate at this time is, I believe, 14 days based to double the cases that we have right now. Looking at the median R effective, which is the reproduction number, meaning how many cases a single case will generate. Currently, that stands at 1.36. And we can see that starting all the way from November and even mid-October, our effective continues to be more than one, which means that every case is generating more than an additional case that they already have, pointing out to ongoing transmission in the community. And we like to see R effective going down under 1. And when the R effective is less than 1, that means new cases, the rate of new cases are slowing down in the community. But at this time, for almost 2 months now, we are seeing that the R effective continues to stay more than 1, leading to more cases in our region. So in summary, our case rates are increasing at a much higher rate, much higher than the provincial rates. The acquisition source is distributed everywhere, suggesting that there's widespread community transmission that's happening and that's ongoing. Our hospitalization rates and active outbreak in the region has increased significantly, putting an extra burden on the entire healthcare system. Our day-over-day doubling time has decreased dramatically and is currently worse than the provincial and the Canadian average. And our R effective continues to be more than 1.36, indicating that there's ongoing transmission, and with more cases coming back to us in Windsor-Essex with the existing number of cases. Thank you.
We'll now take questions from the media. Today we'll start with CTV.
Good morning. With the record number of new cases, what do you think that is causing the huge spike in the number of cases?
So at this time, as I mentioned, the cases are coming from everywhere. So there are 27 active outbreaks that we have right now. There are ongoing community transmission. There are cases that are happening in households with one individual getting sick and then infecting all of the close family members. So it put everyone at risk. There's no single source at this time, and those are the issues that we really have to address very carefully. When you don't have a single source of transmission, that means the community is at a much higher risk than before, and potentially putting our vulnerable at risk of hospitalization, ICU admissions, and potentially putting them potentially dying as well. So we have to be really careful with all these numbers that we are seeing right now.
Do you think it's also a case of people not following the measures that are in place under lockdown now and COVID fatigue?
Well, I think that's exactly what we are noticing when we are seeing these cases, and the spread and number of people still positive cases that we continue to see. It's clearly indicating that the majority of the people are either, even though when they understand, I don't want to assume that they don't understand the harms, but a lot of the comfort thing that people are doing to say that, no, I am doing this, so I am not at risk, but everyone else is. But at this time, I would like to say everyone, probably you're not doing what you should be doing, and that's why we are continuing to see cases. So at this time, as per recommendation and guidelines under gray lockdown, stay home. Do not leave only for any essential reasons. Otherwise, stay home. Do not meet with anyone who doesn't live inside your house. So it is as simple and as basic message as there. And I know it's hard. I know it's challenging. But if we really care about our community, if we really want to protect the lives in our community, we must do it. And that's the only way we can get through it.
Thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. We had heard yesterday during the Board of Health meeting there that there was talk of additional lockdown measures that might be instituted. Can you clarify or elaborate on any discussions concerning that?
Well, we always talk about what more we can do, what is the source of this infection, where do we put our efforts in containing the spread. Clearly, based on the data, what we are seeing is despite some of these restrictions, it's not the same. It's not, we are calling it a lockdown, but it's not truly a lockdown. So we need to get that control. In the first wave, when we went into the lockdown, practically everything was closed. There was literally very few people out on the roads, and that led to us flattening the curve. That led us to save lives. That led us to protect our healthcare system. Right now, with this current restrictions, there are still many people that are out. There are still many businesses that are open, and either for the reason that they are open and people are visiting there, or for the reason that people don't want to sit at home. A combination of all those is continuing to lead to new cases, which is putting the entire community at risk. So when we are talking to our colleagues and talking about a public health system in general, we always try to figure out a way to support our community based on our local data, and we'll continue to look into all the ways to support our community.
And in terms of that individual action that you talk about there, I know you touched on it in your comments during the briefing, but now that we've crossed, this grim milestone of more than 1,000 active cases, we hear about, there needs to be more talk of the recovered cases and this and that, but now we're looking at currently more than 1,000 active cases. Are things at a point where we should just be treating everyone as if they're, COVID positive in terms of, how we interact and all that, or even people within our own household, considering this spike that we're seeing?
Well, absolutely, and I think that's, I've been saying this, I would just be careful about just the household, because at this time, obviously your household, who is going out and who could be exposed to other people. And generally my recommendation would be anyone who is going out and interacting with other people, there has to be some consideration in how they are interacting. And just in case, let's say if that person who is leaving the household for whatever reason, if that person gets sick, what is the plan for the rest of the rest of the household member? And I would just remind the media release that we have sent out, I believe 2 weeks ago or a week and a half, with some directions or with some recommendations for the community members to what to do, make a plan, think about all the potential risks that you are putting yourself in, maintain a diary, and that will help you even just to look at what your activities are. And for those who are not maintaining that, obviously, then they are probably doing a lot more than they should do, which they need to look at it and they need to cut it down. So anyone within your family, if they are at risk or if they work in that high risk settings where they could be exposed, yes, you may have to think about keeping yourself safe or having a plan in place that if that person becomes sick. But if that person who is at a high risk, let's say if they show any symptoms, the reaction for the rest of the household contact should be to immediately implement their plan for self-isolation. Because unless proven otherwise, if people are outside, if they're interacting with other people in high-risk settings with the possibility of acquiring COVID and then showing symptom, the probability would be high based on our person positivity. So in order to protect the rest of your family members, you should immediately implement your plan of what it looks like if that person comes back positive based on the lab.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. It's been 4 full days since the schools have been doing online learning, since the region has been in gray lockdown. Would you have expected to see some kind of impact by now, or is it still too soon?
I think it's still too soon. So right now, even the cases that we are seeing, it's probably around the weekend or the week before. So whatever the impact from a school perspective, we expect to see next week or the week after. But I think now looking at the numbers, I feel much more comfortable made that call to dismiss the school with this many high case rates in the community. I feel I worry about our children, and that includes even my own children as well as many other kids, many other children in the community. So we'll continue to look at that data, and we'll continue to share our data with our colleagues with the province to help them maybe look at some of the comparison. And again, I want to just be clear, the message on when we are talking about switching to online learning, it is not to undermine the importance and value of in-person teaching. That is the best thing that we can do, and all of us should find ways to do that in-person teaching. There's no doubt in my mind, there shouldn't be any doubt in anyone's mind, the quality of learning that we can get from in-person learning versus the online learning. But we are in a different time. We are in the middle of a pandemic with a case rate that is 3 times higher than what we have seen in the first wave in our community. So there is that level of concern and anxiety in my community, and we want to work with everyone involved, including our school boards, including everyone who is affected by it. There may be some concerns in the community with the school closures, but I just want to be very clear that we fully support in-person learning, and we will get back to in-person learning as soon as possible, and as soon as we have our cases in the community at a manageable level. Right now, the children are scheduled to return to in-person learning in early January, and we'll continue to look at the data to make further recommendations.
And the Premier is holding an emergency meeting this morning with some health officials. Is there anything that you would like to see come out of that meeting?
Well, we do have ongoing conversation with our branch of the ministry through the Chief Medical Officers of Health Office, and we have provided with our recommendations and our local situation, and we're hoping that at the end of all of this, some of those recommendations be implemented in Windsor and as well as more broadly.
Can you touch on any of those recommendations, what those might have been that you passed on?
So at this time, as I said, we have put in a number of recommendations, so we'll have to wait and see what the provincial direction come from. And as I always have said, and I'll just repeat it again, anything locally, if there is any point, any high risk issue, we don't have to wait for the province. We'll just immediately act and we'll take care of it. But some of these recommendations are obviously much more broader, and it does require some provincial decision to happen.
Thank you.
Any questions from the Windsor Star?
Hi, Dr. Ahmed. So at the beginning of the month, we were setting records for new cases in the numbers of the 50s and the 60s. And now this week alone, every day it's been a triple-digit increase, 243. That easily surpasses the previous record. How alarming is this to you?
I don't know. I need to find words to explain how alarming it could be. We've been raising this alarm for almost like more than 2 months now. We've been saying that this would happen if people don't follow these recommendations and these guidelines. And despite our reminders, despite our warnings, maybe a lot of the people didn't take it seriously. And we are seeing that result. And I'm not saying, I don't want to paint everyone with the same brush, because there are citizens of this community that are following all these recommendations as best as possible. But there are still a significant number of people who either don't care or either who think that they will be fine even if they're infected, and that's leading to ongoing transmission, which is something that nobody can control on other than our own behavior. So as an individual, as a resident, if I am controlling my behavior and I'm not following any of these public health measures, then I would not only be putting myself at risk, I'll be putting my family at risk. And if, God forbid, if there's anyone in your family who could be vulnerable, who could be a high risk for contracting and developing more severe complications of COVID, that you could be the reason for that person's illness, or even in the worst case, them dying for any reason. So I think it's important that we understand the impact of our decision. It is not as simple as, I want to do something and I should be able to do it. Absolutely respect that. But right now, what we are talking about, it's much bigger than just our own selves. And this is a global pandemic. And some of the comparison that we talk about every time, comparing different countries, is just to give you an example that how worse it can get very quickly if we haven't put these measures in place, and if we don't put these measures in place. So I think it's really important that people look at that. We are at a place, and what I will say is it's really unbelievable to see the case this morning. Just a few weeks ago, as you mentioned, when we are seeing cases in the 30s and the 40s, and we are just saying, oh my God, how worse we can, we have gone to, because 30, 40 cases, that was the maximum that we have seen even in the worst cases of the pandemic. But consistently reporting 3 digits case, it's unimaginable. Reporting 243 cases, that probably is a week's worth of case that we are reporting in just one day. So you can understand the magnitude of the problem that we are dealing with. We definitely don't want to be another community, another region with people dying every day, but still people are dying. And again, as I said, the impact of all these cases, we will see in the next 2 to 3 days. We definitely don't want to see more people dying in the region, and we will save as many lives. We must save every life in our region, and to do everything that we can to protect our community.
And essentially, mid-December, we're still at the beginning of the winter. Do you anticipate new records of hundreds of new cases coming up?
So at this time, with the current rate that we are seeing and with the current trend that we are seeing, I anticipate that at least whatever we are seeing, it will continue at least for 1 week before we can even see. Even when we are talking about comparing what happened in Toronto and Peel, it took them at least 3 to 4 weeks to start seeing results of lockdown. So we went into lockdown just about a week ago, and again, it all ends up with people's behavior. If people are not following these lockdown measures, we will continue to see the cases despite all these efforts that everyone is doing their part. So I think as a community, we all have to take our responsibility, but we expect to see more cases at least for a week, and then we're hoping that if people are following those guidelines, we'll start to see a decline in the number of cases.
Thank you.
Any questions from AIM 800?
Hi, good morning. I'm just wondering, going back to what Maureen was talking about these school closures, obviously you made the decision here locally, Dr. Ahmed, to close the schools, outside of what the province has decided. And we heard earlier this week that the Minister of Education has told school boards to prepare for all possibilities, essentially, including virtual learning come January. Do you think that regardless of what decision is made at the provincial level, you will still recommend that students go back to school in January, or perhaps wait out any cases that may pop up since over the Christmas break?
Yeah, I think we'll have to wait and see and look at the data, probably in the next week or the week after, to see how we are doing as a community. Right now, our schools, we are in a much better position to have that online learning available to our students. So in case if we make that decision, then it wouldn't be a huge change from what we are currently dealing with. So I really hope that our case count starts to go down so we can feel more comfortable sending our kids back to school. But we have to maybe think about it not only from a public health perspective, but also think about as a community that how much risk or what we feel should happen for our schools in the region.
Okay, thank you. And I'm also seeing lots of people talking on social media, and we've had some people asking our newsroom, for families that have been using other family members, maybe grandparents or aunts and uncles, for example, as childcare over the course of this pandemic, even though those people have continued to be exposed to each other, are you still recommending that they don't gather for anything over the holidays, even though they have been seeing each other this whole time in, purposes of childcare and whatnot?
So, Christy, the way I will answer this question, because whatever I will answer, people can use it to make their own decision. Generally speaking, when we are saying stick to your household, so that means the people that I live with and the people that I see every day, and again, the risk can be very different. So even when you're saying that, yes, I'm using my grandparent to come and see my take care of my little children, but if my grandparent are not going anywhere, and then probably, they could be almost similar to my own household. So that's different. But then using it as another example to say, hey, whoever can do, and then this person is moving from one home to another, and then we're saying, okay, let's just bring it back together. So there are a number of nuances that goes into it. So I don't want to answer whether it's right or wrong. What I can tell you from the guidelines perspective, anyone who's not part of your household, you should not be seeing them. You should not be having any kind of close contact. But for those who live alone, they can get together with one family during this holidays, because we recognize this is important time, and people shouldn't be alone just for that specific purpose. But I cannot give you a blanket to say that it's okay for those people who are using their grandparents to take a look after their child.
Okay, thank you.
Any further questions from CTV?
Yes, just one more question. The woman who died, was she a member of the community or a resident of long-term care?
She was a member of the community.
And was she in hospital, or do you have any more details about that?
I believe she was in hospital, and she did have underlying health issues.
Okay, thank you.
Any further questions from CBC?
Yes, I know moments ago, Dr. Ahmed, you had mentioned that you put in a number of recommendations to the province, but you can't say what they are. But you had mentioned if things get to a point of concern, the health unit would look at issuing new orders and new regulations. Are we not already past that point where, with more than 1,000 active cases, it's time to issue new orders and regulations? What would it take in terms of numbers and in terms of the case count to say, okay, now things are so bad that we have to start issuing new orders and new regulations?
So most of these orders, as you can imagine, these are all adds up onto what is available and how we can strengthen it better. When we talked about putting in additional orders, that was in anticipation of whether we stay in red, whether we stay in gray, or whether we stay in orange. So those considerations were there and were at that level. Since the lockdown is implemented, obviously we are also looking at what additional measures that we need to put forward. And as you have seen, the school is an important measure that we made. We made that decision based on our data, based on our local epidemiology. So those are the kind of measure that I was referring to. But some of the other measures were something simple in terms of restrictions, in terms of how many people should be in any of these business establishments. Moving into lockdown has already brought that number down to 50% of the capacity limit. So there are a number of those issues that we continue to see, and we continue to work with the team based on the data, based on the evidence, and we will continue to add that. I think the key part still is when you have this much widespread transmission, you need almost like a reset button. You want to reset everything. You want to say, okay, everyone just go back to where you were, and then we start to slowly get back to how life should be in a much more controlled way. With this much widespread transmission, no single measure will help us to get to where we want to go. So that's why we're hoping that the province will make some significant changes to the current guidelines, and that would help us, not only Windsor-Essex, but the entire province, because we're already reporting 2,400 cases a day, that's not simple. So we like to see a much more broader implementation of rules, policies, to almost get to a point of saying, pushing a reset button to get things back to where it should be.
Okay, thank you.
Any further questions from Blackburn?
Yes, you mentioned this in your epidemiological study a little bit. You touched on the outcomes that we're seeing. Have there been comparisons made to the first wave to the second wave? It seems as though the death rate might be a little bit lower, but hospitalizations seem much higher this time around. Is that just because of the age group that we're seeing the cases in, or because it's being treated differently now?
Well, what I can say, and again, that's a good question. What I can say is with the first wave, we have seen many people dying. And when people are dying, obviously they're not staying in the hospital. So now, as I said, we are doing a better job in taking care of these people. So that means that people are staying longer in the hospital because we have better modalities to treat them. And as a result, they are not dying. But on the flip side, you're seeing more hospitalization. And again, some of that is the function of the number of active cases we are seeing at any given time. So right now, the active cases right now is close to 1,000 cases. That's quite a lot. And the hospitalization, and we talked about that, is an indicator of 10% of the people that you have that contracts COVID. 10% of them will end up in a hospital system, and close to 2 to 3% of them will die. So if we do the math, sometimes it's just a function of those two factors that we can see.
Thank you.
Any further questions from the Windsor Star?
Dr. Ahmed, is there an announcement coming today regarding these potential new restrictions?
I am not sure. We'll have to wait and see. I heard this from the media that there's a meeting. I haven't heard anything directly from the province. We have always, just like always, we have shared our cases, our details with the province regularly, and we continue to do that.
Yeah, thank you.
Any further questions from AM 800?
No, thank you.
Thank you, everyone. Have a good weekend.
Thank you.